So without further ado, good evening, everybody, and welcome to tonight's Young School of Nursing Class of 2025 Admitted Student event. I am pleased and privileged to introduce to you tonight Dr. Donna Glynn, the Associate Dean of Pre-Licensure Nursing here at Regis College, and she, along with several of our wonderful nursing students, is going to be talking to you tonight about the Young School of Nursing at Regis College. Dean Glynn.
Thank you, Laura. So welcome, everyone, and thank you for joining us tonight. First, I want to commend the seniors, the high school seniors in the crowd. You've gone through a lot, and I'm sure your senior year isn't what you had anticipated it to be. But I want to commend you for that, and I want to commend you for your perseverance. And I also want to commend you for your interest in Regis. So I've done a couple of these events through the year, but today I'm really going to talk about why Regis. And I know that you all love the information that I provide, but I do have several of our nursing students here. So this will provide you with an opportunity to ask the student nurses in my program what they think makes Regis special. Laura, the next slide, please.
Great. And to our guests this evening, if you have questions at any time, please feel free to put those in the chat box. And if we don't answer them immediately when you present the question, please note we will be doing a Q&A at the end of the formal presentation.
So the BSN undergraduate nursing program at Regis. Let me start by giving everyone a COVID update. We are up and running. We will absolutely be up and running in the fall. A year ago, on March 16th, everything was closed down by Governor Charlie Baker, and our nursing students were removed from clinical. Fortunately, because of my talented Office of Clinical Coordination, they had already completed just over half of their clinical hours. What people don't realize is that the hospitals reopened to nursing students in July 1st. And the first hospital in the area that actually reopened was Boston Children's Hospital. So I do have some accelerated programs in the summer. So those nursing students were the first ones in the door. So that's when the clinical components of our courses resumed. The fall was like any other fall. We actually, under Regis, made a very thoughtful and very wise decision. We came back in August. We came back the second week of August, and all of our clinicals were completed before the holiday surge. So our clinicals are up and running. Our classes are back in person for the most part, and we're hopeful that we will have defeated COVID and we will be back to the pre-COVID normal by September. Other information that I think it's important for you to have as you're making your decision about which nursing school to choose. I just want to say that the Regis College undergraduate nursing program is fully accredited by both the Board of Registration of Nursing in Massachusetts and the Accreditation Commission for Education in Nursing. We had our most recent reaccreditation site visit in the fall of 2019, and we got a full accreditation, so the accreditors won't be coming back until 2028. So we are fully accredited. Now, what does that mean? That means that our program has met the state and national requirements in order to provide nursing education. We have demonstrated that we meet the classroom content requirements, we meet the clinical content requirements, we have adequate staff and faculty in both the classroom and at the clinical settings. So that's an important concept, and it's an important question to ask the programs that you're looking at. Another thing that makes my Regis program special is our nursing clinical courses begin the second semester of your sophomore year. That's important for a couple of reasons. First of all, I want people to be exposed to nursing in the acute care hospital in their sophomore year, because this way, if someone doesn't like nursing, they have time to pick a new major. But the thing is that the nursing students like about this is after they complete their first clinical course, professional nursing, they're eligible to work in any of our greater Boston hospitals as nursing assistants. There's no requirement for a nursing assistant course or a certification, because at that point, we've provided you with the basic care of the patient in professional nursing. You've also had the health assessment lab, you've had skills lab. So this provides our nursing students with an opportunity to work as nursing assistants in the summer. And I can tell you that this week, I received a call from Brigham and Women's looking for my sophomores who would be available this summer to work as nursing assistants. So that is a great benefit. I'm very proud of our nursing lab and our simulation center. Our nursing labs are always active, even with COVID and social distancing. We've made all of those adjustments. Where our simulation center is so up to date. The simulations that we do, so if you're not familiar with the Simulation Center or you haven't had a chance to go on the webpage, we have high fidelity mannequins. And what that means is these mannequins can talk to you, blink at you, they can vomit, they make urine, they have heart sounds, their pupils will constrict or dilate. So we use these high fidelity mannequins. Other simulations that we do, as opposed to basic care and comfort of patients, is we have a stop the bleed simulation where we have a patient who's undergone a traumatic accident. We have bedside emergencies. We have a code, which is actually run by one of our adjunct faculty who's a paramedic. We do an active shooter scenario, unfortunately developed after what happened at the Brigham and Women's Hospital several years ago. So it's not like my faculty down in the simulation center are just doing the same simulations over and over again. We're always, always, always connecting what's going on in our community. And as you can probably guess, the biggest focus in this last semester has been on COVID, donning and doffing PPE, care of the respiratory patient. So we really had more of a COVID focus. Another thing that makes Regis very special is all of my nursing faculty actively practice. So when you're in that open lab, you're working with a nurse who's at one of the greater Boston hospitals and comes in one day a week to work with the nursing students. My classroom faculty all practice. I'm actually a nurse scientist for the Boston VA healthcare system. So one day a week, I am at one of the VA Boston locations. So by saying that, you're not learning the skills and the critical thinking and the important content from individuals who aren't at the bedside. We're all caring for patients. We're all current in the latest technology. Some of us are even now current in telehealth. So you'll be learning from active practitioners. We also have received Cummings grant resources, and we have a sustaining Cummings grant, which provides additional tutoring to our students, provides extra lab resources, which keeps our labs so robust. And that is a sustaining grant, which just provides additional resources to our students. And one thing that I that just happened this semester was our health assessment faculty. One of my newer faculty members, Emily Rumble, is taking over health assessment. And she said to me, do you mind if I bring in a couple of nurses that work in the neuro ICU at Mass General to work with the students? Of course, I said, please. So we just hired 5 health assessment faculty to work with our students, and they're all practicing in the critical care unit at MGH. So that is very exciting. And one other thing I just want to mention, this is probably not a great thing for the parents to hear, but at least 60, probably closer to 70% of our BSN students go on to seek either their master's or their doctoral degrees in nursing. And what Regis's curriculum actually does is it allows for nursing students to take up to 3 graduate courses during their undergraduate preparation. And I strongly encourage nursing students to do that. There's no additional cost to that. The courses that we offer focus on leadership, focus on advanced health assessment, focus on nursing theory, focus on advanced research, and it's a great opportunity for our students to just start the next step in their education. And that's also a great thing about nursing. You never stop learning. So if you think once you finish your bachelor's, you're done, you're going to just go take care of patients, we're always learning new technologies, new treatments. Look at COVID. We had never heard of it 18 months ago, and we've learned so much in the care of the respiratory patient because of COVID. And that's the greatest thing about becoming a nurse. Next slide, please. So here is a picture of our simulation labs. These pictures were taken pre-COVID because I wanted some pictures without masks on everyone. But we were able to meet all of the CDC and state requirements in social distancing. We don't just have 1 lab room, we have 7 lab rooms. So we're able to provide this experience. The mannequins are amazing. At first, it's a little odd when you're in there talking to this plastic person, but once they start having cardiac changes or respiratory changes, you kind of forget that they're not real because everything they do seems so real in clinical. Next slide. Here are some of our hospitals that we use. Regis College has been affiliated with these hospitals for 20 years. So it's not like any of these are new placements for us. We utilize a central clinical placement platform that most of the Boston schools use, and we put our requests in. We are at the Brigham, Mass General, BI, St. E's, Boston Children's Hospital, BMC, Boston Medical Center, Tufts. Of course, we're in the VA because I wouldn't have it any other way. Metro West, we have Sturdy Hospital down in Attleboro, has one of the largest delivery centers in that South Coast area. So we actually have a couple maternity groups down there in addition to maternity at BID, Beth Israel Deaconess. So we're everywhere. Now, these are the acute care settings. We're also in a whole host of community settings because this way it's going to provide you with just such a wonderful clinical experience. Because even though I teach pharmacology, even though I think pharmacology is the most interesting part of our program, I know that the nursing students would disagree with me and say that clinical is the absolute best part of the program. Next, Laura. So I just want, back up one. I just want to talk about a couple of partnership initiatives. As I said, Regis has a very long history with the Greater Boston Hospitals. I can tell you that Brigham and Women's Hospital approached us in January because there is a large shortage of nurses who with perioperative experience. So those are nurses who work in the operating room. So Brigham and Women's Hospital approached Regis and said, can we try a new model where senior nursing students complete their preceptorships in the peri-op units at the Brigham. And after some paperwork and some administrative tasks that had to be done, the nursing students, 6 nursing students will be starting their preceptorship in the perioperative unit at the Brigham. Now, what the preceptorship is, in case you haven't heard it before, in your last semester of your senior year, your clinical is a one-on-one experience with a BSN prepared nurse in the greater Boston area. The nursing students put in a preference. We try to our best to meet that preference because I personally don't want to put someone in geriatrics if they want pediatrics. We try and meet that preference. And I know that some of our seniors are here tonight and are going to talk about that experience, including Ariana, who is one of the nurses who is going to be starting at the Brigham and Women's Peri-Op preceptorship. And Alyssa is in a NICU down at South Shore Hospital. So we have a whole host. Emma Mendez is at Boston Children's Hospital. So that is a great experience. Boston Children's Hospital has approached us and is having webinars with our students to recruit for nursing assistants and also to discuss the post-graduation recruitment for employment at Boston Children's Hospital. So you're entering nursing at a very exciting time because my generation is getting ready to retire. So we're going to see in the western part of the state, we're already seeing a nursing shortage, and the expectation is that that is going to move towards Boston. So jobs are readily available at all of the hospitals in our area, and it's nice to see that the hospitals are actually coming to Regis and doing webinars to have the nurses, the students apply for positions at their hospital. I already talked about the Brigham, that they recruit actively at Regis, and then also the VA nurse residency program. You're going to hear a lot about nurse residency programs moving forward. A nurse residency program is a paid employment program where after you complete your bachelor's degree, you actually spend a year transitioning to practice. So I'll speak for the VA nurse residency program. They actually hire 18 nurses per year into the nurse residency program. You start on a medical surgical unit, but then over the course of that year, you have opportunities to go into the critical care settings, the outpatient settings, behavioral health, the OR. So you rotate through to all of the hospital settings. And also during that year, you have classes, you have critical care classes, so that it eases that transition into practice. I'm actually affiliated with the nurse residency program, and that is also accredited by the CCNE. So it's a very robust program, and the nurse residents absolutely love it. And as I said, it's paid. I believe that right now the stipend is $75,000 for that year. And the nicest part is too, it's a Monday through Friday, so you don't have to work night, weekend, holidays if you're in the residency program. Laura, next slide.
Actually, we have a question in the chat
Oh,
box, if you don't mind me asking
no,
it.
go ahead. I'm sorry. I should
Um,
have checked.
no, that's okay. No, it just came through. And it's a great question and aligns really nicely with what you're talking about. Does already being a CNA affect any of your classes?
No, it
Okay.
doesn't because of our accreditation, because Bourne requires that, and I'm sure you're probably thinking about the basic skills or fundamentals, because even in those classes, we go beyond the CNA requirements. We start the critical thinking. So already being a CNA doesn't omit any of our classes, but you can actually seek employment earlier. And let me say one other thing. When I say seek employment as a CNA, I always recommend that my students take per diem jobs. What that means is that you're not set to any schedule. The hospital will call you every month or email you, and then you work out how many shifts you want to work. Most facilities require 2 to 4 shifts per month. So I don't want anyone thinking, oh, I'll do the Regis program and then I'll sign up, I'll get a full-time CNA job. I wouldn't let you do that, all right? Because the amount of work, the amount of clinicals, the amount of labs, it would be completely overwhelming.
Thank you. And then a follow-up question is there an option to apply for a job at one of the recruitment sites or one of these clinical sites? What does that look?
Oh, absolutely. So I would say that most of my nursing students, they get the jobs where they're having their clinical, because you're on those units working with the nurse manager of that unit, the nurses on that unit. And nurses love working with nursing students. So absolutely, anyone who wants a job as a CNA, and I know Amy's on the call tonight. She's a CNA at St. Elizabeth's Hospital. The jobs are out there. They really are. And I'm a big believer in we learn from each and every patient care experience that we have. So to do 2 shifts a month, you just gain additional experience. Okay, now this is something that I'm pretty passionate about, and because of COVID, it hasn't been available. Of course, you're going to be studying on our beautiful campus, but we are very hopeful that in the not too distant future, we can resume our study abroad activities and our service trips. We have an agreement with Ulster School of Nursing, which is in Northern Ireland. It was so unfair to us because right before the pandemic hit, the Ulster nursing students had come to Regis for 2.5 weeks. They sat in on our classes, they participated in our simulation, we brought them to some of our clinical sites, and then the pandemic hit when we were supposed to go over to Northern Ireland in the spring. So we're very hopeful that that will resume once it's safe for our nursing students to travel. I've actually in the past brought nursing students down to Mendoza, Argentina, Universidad de Congreso, where we're there typically for 2 to 3 weeks. And we actually worked at a maternal child nutrition center, doing assessments on these children at risk for malnutrition. So I'm very hopeful that that starts up again. We have a strong relationship with Haiti and the Be Like Brit Foundation. Right now, the government in Haiti is very unstable, but we're also hopeful that that is going to start up again. And the service trips that our students go on, I want to go on a service trip. They've gone pre-pandemic, they went to Los Angeles and the Mexican border. They went to Kenya, Puerto Rico, Appalachia. So, I mean, I just think that's such an amazing opportunity to study abroad. We also have the traditional study abroad for a semester if you want to do that when the world calms down again, and we recommend that you do that first semester of your sophomore year. But many students came to us and said, instead of a whole semester away, are there any options for an abbreviated? And that's when we came up with this for, so most of them are 3 weeks. The service trips, the Kenya trip, I believe was 2 weeks, but this way you get the experience, the global experience without committing an entire semester to being off of our campus. And I just want to end with welcome to Regis and welcome to professional nursing. I have been a nurse for 40 years, and I had a guidance counselor who called me down and said, okay, you need to pack. And back in the day, it was nursing, teaching, or being a secretary. So I had no idea what I wanted to do. So they sent me to the secretarial part. I lasted a day and a half before the person in charge of the secretarial part brought me back down to the guidance office. And I picked nursing, and it was the best decision that I ever made. I've worked in the acute care setting. I've worked in critical care. I'm also a nurse practitioner. So for the last 25 years, I've been working as a nurse practitioner and now an educator and a nurse scientist. So there are so many options. There are so many challenges, but good challenges, to start in a career where no 2 days will ever be the same. So congratulations on your decision to pursue nursing, and welcome to Regis.
Thank you so much, Dr.
My
Glenn.
pleasure.
I am going to ask at this time for our wonderful current Regis College students to please turn on their videos and their mics as we open it up to the Q&A session. Dr. Glenn, I'll ask you the question, but feel free to have one of our incredible students also answer the question. I think some of these questions are going to be really important from their perspective. So we're going to get started right away. And the first one is, do students go to their clinicals as a group? And are they required to supply their own transportation? So I think this is a really great question. We get this often. How do clinicals work and how do our students get there?
Want me to take it, ladies?
Sure.
Yeah. Okay. So Regis office, if you're living on campus, right? Regis offers a shuttle bus that takes you to the T. All right. And I strongly recommend that people take the shuttle bus and take public transportation into especially the Boston area hospitals. To drive to and park at Mass General, last I checked, it's $52 a day. I don't want you spending that. There's plenty of options for public transportation. We always notify everyone in the group. If you want to drive together to clinical, that's an option. If you drive to the Brigham actually has shuttle buses that bring nursing students and medical residents over to Mass General. The VA from the Jamaica Plains site has buses that go to the West Roxbury campus. So there's that, but remember now, here's the downside to nursing. You have to be there most of the time by 6:30. So that bus starts early, but that's the way that I recommend that you get to clinicals. Ladies, what do you think?
Yeah, no, definitely. I think public transportation is the way to go. So specifically in the Boston hospitals, if you're at like Newton Wellesley and they have parking there, we typically a group of us just commuted together and switched off every week. So I would recommend that too if you wanted to carpool.
I can tell you the VA has free parking. That's really nice. Yeah.
Yeah, you make some like friends with your clinical group driving together and switching off for a week. So it's nice little time to bond and talk about clinical.
Nice.
The follow-up question to that was, can you talk a little bit more about the clinical groupings? How big are the groups? What does that look like? And the difference between the clinical and the preceptorship that happens that senior year?
Okay, so the clinical groups, the top number, so we're in the Boston area, and the acuity or how sick the patients are in the Boston area, the patients are pretty sick. patients come from all over the world to our Boston hospitals. So because of that, we actually have in the hospitals a 6-to-1 ratio. For every 6 nursing students, there's 1 clinical faculty with you. Now, I say that, but the maternity sites usually only allow 4 students to 1 clinical faculty, and PD in Boston Children's Hospital has 4-to-1. So you feel supported. Be careful of programs that have like a 10-to-1 ratio, because you're not going to have that support that you need, just to have that clinical faculty person with you when you're going in to take care of a patient that you've never met before. I will say for professional nursing, the first clinical course, we actually are very thoughtful about where we place our nursing students. We do a lot more of a basic med-surg unit, or an orthopedic unit caring for people who have had total knee replacements or total hip replacements, as opposed to some of the higher acuity units that we use moving on. And when I say that, I can tell you that bone marrow transplant units we use, step down cardiac units we use. I know during COVID, for our second clinical course, as the nurse manager at St. Elizabeth's, they had an outbreak on one of our units, and that St. Elizabeth's just said, we're going to put them on the step down cardiac unit, and the nursing students had a phenomenal experience there. So, those are those numbers, so you feel supported. As far as the preceptorship, it's you with your with that one nurse, that one BSN prepared nurse. Now, Emma, you're at Children's, right?
Yes, I'm at Boston Children's.
Okay, do you want to talk about that with your preceptorship for a second?
Sure. So I've always wanted to be a pediatric nurse, like going into school. So having my pediatric clinical at Boston Children's, I was over the moon about it. And then when I found out I got my preceptorship there, super excited, because that just puts you in a better position, more experience to get a job, to put that on your resume. So I got my preceptorship. She works on like a medical surgical unit. So I get her schedule, and then I pick days that work with my class schedule. It's night shift, weekends, day shift, all of them. And I just go in, I follow her around, and then I also get my own patients. So I work under her, but also with her, so I can practice being like alone, giving meds, like exactly what a real nurse does. So, and I do that for the entire semester once I meet all my hours, and then plus just to get the most experience I can. So
nice.
I'm very excited, and I love it.
Thanks, Emma. And let me just say that we have a whole clinical coordination group. No student has to go out and find their own preceptorship. Actually, it's very frowned upon by the Boston hospitals. They want us controlling this. Now, Alyssa, you have to talk about the NICU. How is it?
Yeah, so I am in the neonatal intensive care unit at South Shore Hospital. And like Emma does, I follow around a nurse there, and I get to work with the babies, which is so different because I'm usually working with adult patients and these little tiny humans. I get to change, feed, help give medicines to them. And yes, we get to cuddle them, which is the best part when we're documenting. We can just have them on our arms. It's great. But neonatal is what I want to specialize in, hopefully. So it's a great opportunity. I love it so far. I've only been there a couple times. So we need 130 hours. So what we have done was I created a schedule for like March, which works for me and what works for her. And then I should be finishing up the first week in April there. So.
Excellent. Now, Erin, you're my junior. So where was acute care? Where was your clinical for acute care?
My acute care was actually, I was going to interrupt you, but I didn't want to, was actually at the St. Elizabeth's Hospital, where we got moved from the cardiac unit to the CICU.
Oh,
So.
And they were so great to work with. As COVID was taking over again, they were amazing. Talk a little bit, Erin, about that. And then I'm going to ask Amy, because Amy's doing a preceptorship there.
So I started out on a basic cardiac floor, which is something that I was looking into and to pursuing for like my preceptorship and everything and after nursing school. So I was super excited. But then like 3 weeks into it, COVID hit and like pretty much all the patients on the floor got COVID. So we had to be removed. We had like 1 week of virtual clinical. And then immediately after, we were put into CICU, which all the nurses were fantastic. I actually sat down with one of the nurses for like a half an hour with her, like talking about like her different patients. So I thought it was a great opportunity. And then we got to go back to 6 West, which was our floor that we were on originally, and finish up our clinical. So it was a really smooth transition.
Nice.
Dean Glenn, I'm sorry to interrupt, but this is a clinical question that's coming through the chat box from our guest tonight. Can you talk about how clinical placements or the clinical component of a student's curriculum is graded? How are they issued a grade? And then Alyssa, a follow-up question to you from someone about your experience. You're in the NICU. Is that the same as being in labor and delivery or OB, or is that different? And would you have a clinical rotation in a labor and delivery floor? So 2 questions for the group.
You want me to go first?
Go ahead, Alyssa. Yep.
Yeah, so NICU is entirely different from maternity, pediatrics, infants. It's basically really sick babies or premature babies. So my patient last week was 3 pounds, so it's usually really small, sick kids that are there for extended periods of time. And you will have a maternity rotation. So I was at labor and delivery at Newton Wellesley. So we had a full rotation of that, and then we had a full rotation of pediatrics as well.
Perfect. Thank you. And let me just answer the clinical. Clinical is not graded. What happens with clinical is the nursing students know what skills and competencies that they have to finish while they're at clinical, and the clinical faculty assess their ability to do a cardiac exam, a lung exam. And I always encourage the nursing students, you can always practice those skills in our skills lab also. So it's very rare that someone doesn't meet those competencies just because of our small clinical group numbers and all of the options that we have for additional practice in the labs as needed. So there is no grade with clinical.
And then Dr. Glenn, can you just remind everybody how many people are in each group for clinical?
So for the typical med-surg units, for every 6 students, there's 1 instructor. At Boston Children's Hospital, they take 4 to 1, and some of the maternity ones are 4 to 1.
Great. Staying on, we're going to stay on the clinical questions for a couple. And Dr. Glenn, I think these are just going to be rapid fire to you for a minute. How long are clinical shifts?
8 to 10 hours.
Great. How many students are expected in a typical Regis College nursing class? So we're looking at the incoming class of 2021. Approximately how many nursing students? I know we have, because of our clinical placements, we are able to accommodate a large group. Do you want to talk about that?
So Regis, like all of the schools in Massachusetts, are governed by the Board of Registration of Nursing. And that's where, so if you're considering Regis, please, please, please deposit earlier rather than later, because once our numbers are full, they're full. We typically, Laura, what are we taking in freshman year? 130-ish?
Yeah, our 120, and then we move to that one, that wait list. Keeping in mind that we would alert students as space fills. So for those of you that are making your decisions, waiting on some additional information, please note that we will send you regular reminders of how many spots are available or if the spaces begin to fill. Please keep in mind, and this dovetails into a question in the chat box, some of you have been admitted directly, some of you have been admitted as an indirect nursing student. What that means is that the students who are admitted in an indirect status, you will still follow through with the same curriculum, the same program. We assume that you will be moving into the nursing program at the end of that first semester of the sophomore year, but you're going to be getting some additional support and outreach from faculty. to make sure that you're in a great space and place. So if you're admitted in an indirect status, just know that that is to really look at how we can make sure to provide any additional support in some of those areas. But again, we work off the assumption that because of our support services and our ability to help, that you'll be able to move through, right, Dr. Glenn?
Right. And let me also, anyone who has been accepted but indirect, I count you in my numbers for clinical. So it's not like when clinical start, you're just kind of keeping your fingers crossed. You're part of this cohort, but we really want to identify you so that it's usually one science or a math course that just made us worry a little more about you, but we want to be sure that you get that extra help. So if you're an indirect student and you meet all of those grading requirements, particularly with the science courses, to have a GPA of 2.7, you're in. All right. And those are the numbers that I count from the start.
And this is always everybody's favorite topic of conversation. And I'm looking at my seniors because I know that you're going to hear the word ATI and know where I'm going with this. There it is. One of the questions, and it's a great question, and it's an important question. Can you talk about the NCLEX pass rate at Regis, Dr. Glenn? But can you also talk about the ATI exam and the NCLEX prep that we do?
Okay. So last year was not a typical year because of COVID. NCLEX turned into a lot of craziness, but we were still able to have an 85% pass rate, which is outstanding, down from 90 the year before. There were great challenges with our students being able to get test sites. Many of the sites, because of COVID, though they were delayed, they had to wait 2 to 3 months before they could even sit for the NCLEX. So that's going to be behind us, right? Seniors, we're not going to deal with that. But we do have a platform, ATI, which is a testing platform, and it's part of our curriculum. How many NCLEX style questions have you taken? 2,000, 3,000? Yep, okay. So it really prepares you for the NCLEX. After you graduate in May, we actually have a NCLEX test prep, which is included in the package. And then if you wait for that green light before you take your NCLEX, I can guarantee you 97% of students who wait for the green light pass the NCLEX. It's the people who didn't make the best decisions who sometimes struggle. So it's very timely. The refresher course starts right after graduation. The refresher course is a 2-week course, 3 days 1 week and 2 days the next. And then you're actually assigned a tutor through ATI that continues to watch your progress and work with you on any areas that you may be struggling. Okay, how much do you hate ATI right now, ladies?
Oh, they love it. I can tell.
They love it. Look at that face. How many more NCLEX questions? And you know that NCLEX changed. So instead of 75 questions, the minimum amount now is 60. So you're all going to say to me, then why did you have me doing a couple of thousand questions? Well, it's practice.
There you go. This is a question that I know we get often on the admission side, and I know that there are some wonderful students on the screen that can answer this. Tell me what it's like to be a student athlete, scholar, and a nursing student at Regis. Erin?
So I play softball here. So we just started our spring season. Well, it's not our typical spring season. We are practicing in pods and we don't have any games scheduled, but we're still practicing as if we were playing. But it's definitely a shell shock when you first come on freshman year and you have all those games. For softball, typically we have around 40 games within a season. So it's a lot to compact within the nursing realm as well. But that first year, you really get to know like your schedule, what you have to get done, and like how to time manage. So if I knew that I had 2 double headers on Saturday and Sunday, I knew I had to get all my work done on Friday night and not go out with my friends or go or stay up wicked late because I have a 10 a.m. game and I have to be up by 6. So it's just prioritizing your time and knowing like when you have to get stuff done when you should be staying in rather than like going to like Target with your friends or like wasting some time. But definitely as the years have gone up, I've gotten better at my time management, and also like anyone will reach out to you. Coaches have a Starfish app, which pretty much flags you if you have like so if it's like in nursing, if you get below an 80, you automatically get flagged. So your coach will immediately text you, and that is not the text you want to receive at all. It's scary, but it's nice to have them in your corner. And it also, Regis supplies you with so many tutors, so many different opportunities with like academic coaches who are with you throughout your entire 4 years at Regis. So it really helps.
It's hard to go under the radar because in addition to the coaches with Starfish, all of my faculty have it. Amy, can you speak a little bit about being the president of the Student Nurses Association and juggling all of that?
Yes. So this year I became the Student Nurse Association president, which is like a club of just our undergraduate nursing students. Definitely different than I anticipated it because we're remote. Some of us are on campus. It's a completely different experience. So we've been trying to get creative with how we've done things. So for this year, every meeting we have once a month, we've brought a faculty member in to talk about their experience as a nurse and how they became nurses, because everyone becomes a nurse differently, or why they became a nurse. We actually are in the middle of our faculty appreciation week.
I know. It's been wonderful. Faculty Appreciation Week has been amazing. The Student Nurse Association dropped off hand sanitizer for the faculty for the hands that guided them through this. And then yesterday they dropped off Regis red masks that said Regis Nursing on them with a stethoscope. So my faculty is thrilled right now.
And then like mostly like what our goal is as a club is just to be like a support to one another about nursing. Like a lot of professors will recommend a book and like they'll be like, it's mandatory, you need to get it, you need to get it, you need to get it. And it's like some crazy amount of money. And then like you'll go talk to like students and they'll be like, didn't open the book once. So it's definitely it's just there to like support each other and like getting to know one another. Like my first clinical rotation, I didn't know anyone in my group. And then like, so having that club, like you can go and meet people who could potentially be in your group. And like nerve-wracking is like knowing where to park the first day or like how to get to certain places. So having the upperclassmen, they'll be like, oh, I had clinical there, like this is how we did it. So it's just like there for advice and about classes and like supplies and clinical. So it's been a lot of fun, even though we've been virtual this whole time.
And these nursing students aren't plants. I think myself and my faculty work really hard at getting to know the nursing students. I have representation of the SNA at all of my faculty meetings, because I wouldn't be a good leader if I left out the most important stakeholders, which are the nursing students, when we make nursing decisions. So the faculty, I feel, and please correct me if I'm wrong, I feel that we're pretty accessible, and I think that it's like, don't try and go under the radar at Regis. We won't let you. We will find you, and getting involved is super important. Ariana, can you just talk a little bit about the process you went through for the peri-op experience? It was actually a little different that as opposed to just getting that magic call that you got placed in the NICU. So can you just talk a little bit about that?
Yeah, sure. So I was lucky enough to be a part of this incredible peri-op opportunity, which peri-op includes pre-op, operating room, and post-anesthesia care unit. So me and my fellow classmates were all placed into a Zoom call where we got interviewed by this wonderful woman named Kendra Courier, who represented Brigham's OR for us, and with Dr. Glenn. And we all, got to learn about this incredible experience. We all wrote a little bit of almost like an introduction to our resume, an introduction to ourselves, kind of to interview for this opportunity. And lucky enough, almost all of us got it, which was great. It was so incredible to hear that I could celebrate with my fellow classmates, that we all could be a part of this together and represent Regis in a different way that no one's done before. So I think it was kind of yes, it was a different road to getting my preceptorship, but I think it's a very valuable and worthwhile one.
Excellent. Thank you.
Thank you. I have two more questions. So the first one is, because I know that Donna, you love transfer students and working with transfer students. I know we happen to have a transfer student on our screen right now. Do you just want to talk very briefly about what it's like to be a transfer student in the program and what that transition looks like and how they fold into the cohort?
I would say being a transfer student is very similar to being a student at Regis. It's really how much the student themselves gets involved. If a transfer student is living in the dorms, I think that's easier. But if the transfer student is commuting, it's not going to class and then going home. It's becoming part of the community. It's joining the Student Nurses Association. It's going to open labs. But quickly, once clinicals start, even for our transfer students, you just become part of the group, because you form these bonds with the other nursing students when you're going into a room to wash up a patient or to start an IV med. So those are some of the things that that create those bonds. But I always worry when someone is a commuter or just comes to campus and then goes home, because then you're missing so much of what Regis has to offer. You're missing those open labs, you're missing those study group sessions, and that's all what makes us special.
Alyssa, did you want to add anything?
Oh, sure, I'll add it. So I transferred here. I technically would have been a junior, but since I transferred into the nursing program, I had to go back to sophomore year just because of the whole clinical thing. And at first I was like, oh my God, like I'm doing another year. Like this is so not normal, but it's so normal. So if you transfer, like Regis College has been so welcoming compared to the school I came from. Yeah, I don't feel like a transfer. The one thing I do recommend, like Dr. Glenn said, was to be involved, because I was never involved at my other school, and I honestly think it hurt me in the long run. But being here, I'm part of SNA, I'm part of All Season Society, I work in admissions too, and I've just met incredible people, and I wouldn't have been able to do it if I commuted here. But yeah, so I love it, and everyone's been amazing.
And for our transfer students, we have a dedicated person, Abby Doyle, who works as a transfer advisor, just to be sure that all of your classes are all set, which courses we took, which ones you have to take at Regis, and Abby's wonderful.
Great, thank you. All right, I have two more questions. One I can explain for the group. It's an admission question. And the second, I think it's a nice way to end it by asking each of our students this question. So the question that I'll be answering, can you explain what it means to be admitted as an intended nursing student? So you have all been admitted either directly or indirectly to the Young School of Nursing as an intended nursing major. What that means is that you are one of the individuals who have been offered a spot in the nursing cohort for the class of 2021. You will follow the nursing prerequisite curriculum your freshman year and the first semester of your sophomore year. And then at the end of your sophomore year, the nursing program will do their review and officially move you into the program. The only students who have that categorization of an intended nursing student are students who have applied and been reviewed by admission in the nursing program to be in that track. So essentially you are a nursing major, but the confirmation of your status in the nursing program due to accreditation standards actually cannot be confirmed until after you've completed your prereqs. But if you see that intended word, just know that that means we look at you at Regis as a nursing student, and then that final confirmation is what you get at the end of the second semester of your sophomore year. Awesome. Okay, here is a wonderful final question for everybody. And I think it is a great one. It's an enthusiastic one. How nervous were you for your very first clinical, and how did you calm your nerves? It's a great question.
Great question.
I'll start that one.
I can start. I don't mind. So my first day of clinical, I was at St. Elizabeth's. We were on a med surg floor. Had never been in a hospital setting before. Out of the 6 of us in a group, only one had been a PCA or a nursing assistant, and she was at a nursing home. So none of us had been in that acute care setting. I remember listening to a report, and I was like, I don't know anything they're talking about. Like, I don't know a single word they're saying. Don't know what it means. Terrified to go in. And then I remember our instructor, thank God, paired us two together. So like we would go into the room together. And I was with this girl, Kirsten, and we became friends from clinical. And we went to the room and we knocked on the door and we were told she was a retired nurse and all this stuff. And we go in and we're like, hi, we're student nurses. We're gonna be taking care of you. And then she was like, I don't want student nurses. And we were like, oh. So slowly we walked out of the room and found our instructor. And she's like, you're kidding. So we had to get a new patient, which was totally fine, but it was like totally terrifying. The idea of like going into some room and like waking up a patient. And you're like, why am I waking them up at 7 a.m.? But from there, you just became more confident. And I then that summer became a nursing assistant at St. Elizabeth's. And now my senior practicum's at St. Elizabeth's. So I have learned so much from just that hospital in particular, but that first day was terrifying. And I was just glad I had a partner to be there with me. And also just like your clinical instructor makes a huge difference. If they're like calm and collected and they're like, oh, we'll just do this, that. So after the first day, it was definitely an easier transition, but that first day was like a shock.
Next, I was also at St. Elizabeth's, but a different day in a different group, actually with Ariana. I didn't know anyone going into it, and then we met and actually became best friends since then. We like went to clinical together. We were paired every week with the same patients, and it really helped because then you make friends, and it honestly turns out fine. Like Amy said, you're nervous that first day. You're nervous to walk into that first patient's room and say you're a nursing student, but then you just get the hang of it and you'll do great and you'll make it. We all did.
Yeah, going off what Emma said, I literally didn't know anyone because I was a transfer. So going in, like, I think I honestly carpooled with someone I didn't really know, but that's how we became close. And then you walk in, you have your scrubs, everyone's looking at you because you're all wearing the same thing. And they're like, oh, these are cute students on their first day. And then you go in the room and I was like, okay, I'm not going alone. So like I had the instructor with me and another student with me. And even putting on the blood pressure cuff, you're like, oh my God, am I doing this right? Like, is this how it goes? But then like, once you go, you'll feel more comfortable and it'll be great, like Emma said.
And just to continue on to that, I mean, kind of going off what Emma said, I was lucky enough to have somebody in my group who like I'm still friends with now. And I also want to just say, like, clinical aside, Regis has just a great group community of nursing students. I mean, all of us are friendly with each other. We all help each other study. It's a great community to be a part of. I'm very lucky to have gone to Regis and meet so many people. And I know that it's scary at first, but you meet so many friends, and in the end, everybody works with each other. I mean, everyone in this Zoom right now, we talk to each other all the time. We study together. We go to clinical together. Like, you're with these people for 4 years. So it's great to, become friendly with them and then be a part of this community where you're all so supportive of each other.
So my first clinical was a little different. So I actually started my first like professional clinical at Bethany Healthcare in Framingham. So I was at a nursing home setting, and I've been continuously working at a nursing home since I was 18. So I was like kind of already accustomed to it, but I didn't know that they were all sisters. So I went into the setting being like, oh, this is just like my work. Like, this is going to be a piece of cake. And then they were all nuns. If you didn't say sister, they got very offended. If you didn't pronounce, it was just, I didn't know going into it. I had no, it was very nerve wracking, but I was the only LNA. In New Hampshire, we call it LNAs, but I was the only CNA within my group, and they all just pretty much like would walk behind me as we would enter a room, and I'm like, come on, like, please don't make me go first. Like, I really don't want to go. But it was honestly, I was with that clinical group for, I think, 2 rotations, and we still text to this day. Like, we're still so close. And I'm the only junior on the call, so I haven't done like preceptorship or anything like that. But I can know from like my experience so far in the nursing program, I've loved every second of it. And everyone in the program just wants you to succeed. And like, you all celebrate together, small victories. Every exam is just like a small little victory. But it's been a great time overall in the nursing program, and I've loved it.
In spite of the pandemic.
Fantastic. Well, we are so abundantly grateful for the time of our Associate Dean, Donna Glynn,
It's fun.
our amazing students, our student scholars on this campus. The future of healthcare is so bright because of students and students leaders such as those from the Young School of Nursing. We are grateful for all of you for spending your time with us this evening. And we are grateful that you took the time to learn more about our incredible and wonderful community. If you have questions that have percolated after tonight's call, please feel free to reach out to admission. I put that email in the chat box, but it is admission@regiscollege.edu. And we'll be happy to send that message to the appropriate contact person and answer it to make sure you have your questions answered at any time. We encourage you to please make sure that you or your student are continuing to check your email address that we've been using throughout your recruitment cycle. That is where we will send critical updates, such as whether or not the program is at capacity. Again, it is possible for the program to reach capacity prior to the May 1 date, and we will communicate that often and regularly. So it is important to us that you have the information that you need to make a really good decision that feels good moving forward. So don't hesitate to reach out if you have questions. Please also continue to keep an eye out on your email for information about other upcoming events, such as virtual tours, financial aid nights, as well as on-campus visit opportunities. We will share those to the email address that you have. But of course, again, if you have any questions, just reach out to us again. We are thankful, we are so grateful, and we wish you all really well as you continue wrapping up your academic year, whether that's the end of your senior year or the end of your current semester at your university. And we hope you all continue to stay well and be well. And thank you again for joining us tonight. Take good care, everybody.
Thank you so much. Thank you.